Jenna McDavid, and I am the National Managing Coordinator for the Diverse Elders Coalition. It's great to see so many of you here in support of diverse older Americans. I want to make a couple of quick notes about logistics before we begin. As you walked in today, you probably received a folder that includes a copy of our new report, Aging with Health and Dignity, Diverse Elders Speak Up, as well as some other materials from us and our coalition members. My business card, my contact information is also in there. In case you want to reach out to me after the event. We also have some interpreters here today, translating into Spanish, and they will translate our Spanish speakers' remarks into English. Catalina is here to explain how the service will work. Thank you, Catalina.
Hi everyone, so just a few reminders for speakers to please speak at a moderate pace. And if you see us doing like this, that means please slow down. We just want to make sure we are interpreting everything that everybody's saying. And also to speak up, and if you see us doing like this, that means please speak up. We'll be in the back interpreting into this little mic. And also, one of our speakers is going to speak in Spanish. We've been giving out interpretation equipment for everyone. So if you haven't had a chance to get a headset, you can still do so in the table outside. Entonces, rápidamente, estamos pidiendo que por favor hablen despacio, que hablen en voz alta. Y si no tienen su equipo de interpretación, lo pueden recibir en la parte de atrás. Gracias. Thank you.
Thank you so much, Catalina. Now I'd like to introduce the 5 representatives of the Diverse Elders Coalition who are here today. On the far right is Aaron Tax. He's the Director of Federal Government Relations for Services and Advocacy for GLBT Elders, or SAGE. Next is Randella Bluehouse, the Executive Director of the National Indian Council on Aging. Here we have Dr. Cruz, who is the President and CEO of the National Hispanic Council on Aging. We have Quinn Jin, the Executive Director of the Southeast Asia Resource Action Center. And finally, we have Dr. Wesley Lum, who is the CEO and President of the National Asian Pacific Center on Aging. If any of you are sharing your experiences today on social media, we're using the hashtag #AgingWithDignity. And you can also connect to the public Wi-Fi here. It's House Public, and the network password is also House Public, capital H, capital P. We also have some partners and some allies joining us today, one of whom is going to kick off our program with some opening remarks. Kevin Simowitz is the Political Director for Caring Across Generations, a national movement of families, caregivers, people with disability, and aging Americans who are working to transform the way we care in this country. The Diverse Elders Coalition partnered with Caring Across Generation on the civic engagement project that formed the foundation for today's event, and we could not be more thrilled that Kevin is here to talk about that partnership and the necessity of caregiving to older adults.
Applause for Jenna and the way we figured out seating. So thank you. My name is Kevin Simowitz from Caring Across Generations. It's great to be here with you all this morning. I'm going to speak slowly and bottle the way that I'm supposed to speak from the podium. And not that all of my announcements have to be about chairs, but are those empty? They are empty? I swear I have other things to talk about, but if you're standing and you'd like to sit, there are 3 spots to sit back over there. So again, I appreciate everyone's flexibility with the logistics this morning. And know that someone is working on switching from heat to air conditioning since it's spring here in February. It really is great to be here, and Caring Across Generations, the decision to partner with the Diverse Elders Coalition was pretty simple. It's about 2 things. It's about a shared understanding of what our communities need to not just survive, but to thrive, and then also a shared vision for what it looks like to achieve that together. So again, Caring Across is a movement of families, caregivers, people with disabilities, and aging Americans working to transform the way that we care in this country. And for us, that means making sure that, on one hand, people are able to access care when they need it and where they want to access it, which for most people means accessing it at home and in their own communities. And also making sure that the workforce, lots of family caregivers and paid caregivers too, first off, are respected, treated with dignity, and that the work they do is valued, and also that the work that they do is paid a fair wage so that people can advance in careers in caregiving and not make minimum wage or less, providing work that is so essential and so crucial to so many families. So I think most people in the room might know every 8 seconds, someone turns 65 years old in the country. If we like pause for 8 seconds. So that's like somebody else. That's 4 million people a year. So the demographic change alone should be demanding that the work that we do is more crucial than ever, and especially at a moment like this, when so many of the programs that older Americans across the country depend upon for safety and security are under attack or being threatened by federal cuts and cuts at the state level. It seems more and more important to stand in solidarity with groups and coalitions who are doing important work. So that's what brings Caring Across Generations here today. Couldn't be more excited to be a part of this partnership and excited to hear the rest of the program today. Thanks.
Thank you so much, Kevin. Now I'd like to introduce Dr. Daniela Cruz from the National Hispanic Council on Aging to talk a little more about the coalition and about this report.
Thank you, Jenna. Good morning. Good morning, everyone. And such a pleasure to see all of you here today with us to celebrate the diversity in our country and to also pay attention to some of the key issues impacting Hispanic older adults and others across the country. So on behalf of the millions of seniors that all of our organizations here represent, I want to thank you for being here, for the work that you do, and for supporting seniors. I also want to just tell you a little bit about the National Hispanic Council on Aging. I had the organization, and we work to improve the quality of life of Hispanic seniors, their families, and their caregivers. We've been around for over 30 years, and our work today, as Kevin indicated, is more important than ever because so many of the programs that our seniors and families and caregivers rely on and need so badly are being challenged. So it's a special day, and again, I want to thank you for being vigilant and supporting us through this journey. So the Diverse Elders Coalition was created in 2010 to address the unique needs of diverse older adults in our country. We are here today to release our new report, Aging with Health and Dignity, Diverse Elders Speak Up. This is the first time we do this type of effort, so it's a special project for all of us and for our communities. This report is based on the nearly 5,000 comments we received from older adults across the country during our 2016 Civic Engagement campaign. The report highlights the challenges and resiliences of diverse older adults. You will have the opportunity to hear about the key findings from each of the communities served by the Diverse Elders Coalition, including American Indian Alaska Native Elders, Asian American Pacific Islanders, and Native Hawaiian Elders, LGBTQ, African American, and Hispanic older adults. I'd like to take a moment to just highlight some key findings from our Hispanic older adults. Hispanic older adults shared that they lack information and services that take into account the specific linguistic, cultural, and age-sensitive needs of Hispanic older adults. There is a great disconnect between programs and services available and Hispanic beneficiaries. Hispanic seniors feel isolated and marginalized. Our seniors express concern about the complexity of key programs such as Medicare, Medicaid, SNAP, which makes it impossible for them to access them. The situation limits Latino elders' ability to access social programs they may qualify for and that may alleviate many of the challenges they face, such as healthcare access, affordable housing, hunger, and nutrition. Despite the challenges, Hispanic older adults are resilient and willing to engage when given the opportunity. Specific recommendations include, first, Hispanic seniors ask asked ACL and other federal agencies to partner with Latino expert organizations to develop and deliver programs and services that meet their specific needs. Second, Hispanic seniors requested that programs and benefits should be designed to be accessible to older adults with low levels of English proficiency and cultural and literacy gaps. Third, programs for Hispanic older adults need to have bilingual staff able to counsel and support this population in a culturally appropriate and age-sensitive way. This effort has been truly inspiring because it has not only confirmed the needs that we have been advocating for, but also the resilience and tenacity of our older adults. That is why the National Hispanic Council on Aging continues to educate, promote, and advocate for the well-being of Hispanic seniors. We advocate to prioritize aging needs in the allocation of resources and funding opportunities. Ensure that programs and benefits address the needs of the growing Hispanic aging population. Continue to prioritize and target the closing of health-related disparities among our population. Create culturally appropriate and age-sensitive volunteer networks that work with community-based organizations and provide seniors with information about social programs and how to access them. Again, I will stop here and let the rest of my colleagues also share their findings. But before we do that, I'd like to take a moment to introduce Dr. Imani Woody, who is here today and who will also share some remarks with us. She is the founder, president, and CEO of Mary's House for Older Adults here in Washington, D.C. And she is going to address and talk to us about housing for diverse elders, which is another important area for our communities.
Good morning. Oh my God, you all didn't have coffee. Good morning. Great. It's so good to see everybody here. A full room, diverse elders, hot dog. My name is Imani Woody, Dr. Imani Woody, and I am the founder, CEO, and president of Mary's House for Older Adults. And it's an organization, a national organization that provides education and advocacy for LGBT elders and mainstream elders about housing and housing opportunities. We took part in the Diverse Elders, what is it called? The Diverse Elders Coalition survey. Yes, your comment cards. Thanks, Jen. The comment cards that we collected, I don't know how many, we collected lots of comment cards from our constituents trying to figure out what we needed from the ACL, what was needed for elders and LGBT elders, and we are excited to see that this report come out. I'm also an elder, so when Kevin was talking about this, somebody turning 65 every X amount of seconds. I had my turn in January, so but I care for my dad and my sister until their deaths, and I currently care for my stepmother. Equally as important or interesting is that I'm a researcher and a diversity consultant on issues impacting elders, particularly elders of African descent and LGBTQ. In these roles, I know firsthand about the many issues and challenges facing elders across the United States. So let's start off with some more numbers. By 2030, 20% of the U.S. population will be 65 years of age or older. The number of African Americans and LGBTQ adults will double by 10,000 baby boomers turning 65 every day for the next 13 years. That's a lot, isn't it? There is and will be an increased need for housing to reflect the needs of elders. Elders to be near stores, to be near services, to be near transportation, housing that promotes productive living and decreases isolation, right? The Joint Center of Housing Studies at Harvard University states that the single largest item in most households is housing, and it directly affects the day-to-day financial security of everyone. High housing costs for many elders often means sacrificing spending on food or medications. I mean, many of us have heard about elders who decide whether they're going to pay the rent or buy their medicines, right? And we've heard those anecdotal stories about folks buying cat food. High housing, the numbers also report that 82% of whites own their own homes, while 58% of blacks own their own homes. This lack of wealth makes other housing options as folks age limited, right? And as an aside, we know that the lower percentage rate of housing ownership has something to do with the systemic racism that exists in housing toward black people and other people of color. Would you all agree in this room? We kind of know that. In addition, much of the nation's housing inventory lacks basic accessibility features preventing older adults with disabilities living safely and comfortably in their homes, although there's not enough affordable, safe, accessible, well-located, and this is important, culturally appropriate housing throughout our country. African Americans and LGBT folks are still finding prejudicial behaviors in looking for housing. Research addressing racial segregation and discrimination has shown that elderly African Americans are systemically denied access to quality nursing homes because of their race and income. There is a widespread discrimination in housing of LGBTQ owners. A recent study by the Equal Justice Center and SAGE highlighted extreme rental discrimination housing toward LGBTQ owners. I found that surprising, and this was like 2 years ago, that study. An older African American lesbian perceived racism as a constant in her life and believed it to be more insidious than ageism or heterosexism. She said, well, I would say that getting older in this country is difficult because we have no reverence for the elderly, which is not true in a lot of other cultures. So when you add another stigma to it, not only am I old, I'm old. I'm an old African American female. And females in this country, at least in my experience, has been that you don't enjoy the same reverence as men do. You add into that, well then he must. So I'm already pretty far down. And when you add being lesbian to that, well, I put you in the toilet. So it's essential that legislatures stand up for the safety net of programs like Medicaid and Medicare, which represent some of the best tools our communities have, that they push forward programs that provide rental assistance, as that makes a difference in the quality of life for our elders, and that they approve housing projects that have supportive services, because if we live, we too will be old, and we want these services and housing to be in place for us all. And I'd like to close with my favorite. I have a starfish story. Many of you have heard my story. Have you all heard the starfish story? This is my story. There was a young girl, she was on the beach, and she was throwing things in the ocean. This guy was way over there, and he couldn't really see what she was doing. But she was picking up and throwing. He got closer, and he saw all these starfish beached on the sand. He looked at the little girl pitching and throwing, and he said, "Look at all these starfish. You're not going to make a difference." And she said, "I made a difference for that one."
Good morning. Got my notes here. All right. Well, thanks so much for being here today. Thanks for Jenna for organizing this packed house. I really appreciate it. And to our colleagues in the Diverse Elders Coalition. I want to begin by expressing SAGE's disappointment in the Trump administration's actions yesterday, repealing the U.S. Department of Education's Title IX guidance advising federally funded educational institutions on respecting the gender identity of students. And you might think, well, why are we bringing this up today? Well, of course, it signals the administration's willingness to attack clear legal precedent protecting transgender people, not only in education, but also in housing and healthcare. Issues that the report we're releasing today shows are critical for LGBT older adults. It also sends a harmful and stigmatizing message to trans people of all ages. But while we're living in unprecedented times, our elders remind us that through decades of anti-LGBT witch hunts, brutality, criminalization, and stigma, they stood firm, they spoke out, and they pushed forward. And they inspire us to speak out against the same kinds of injustices today. Unfortunately, too few people know their stories and the lessons that they learned, and the challenges they and other diverse elders face today. This history and the challenges we continue to face, even from the President of the United States, is why SAGE exists and why we do what we do. SAGE was founded in 1978, and we are the nation's largest and oldest organization dedicated to improving the lives of LGBT older adults. We run the federally funded National Resource Center on LGBT aging, which provides information to LGBT-serving organizations, aging organizations, and to LGBT older adults themselves. In addition to that, we run 5 LGBT-targeted senior centers in New York City. We have 30 affiliates in 24 states and the District of Columbia. And we run a whole slew of other programs, including a workforce training program, caregiving program, so on and so forth. And you can learn more about that on our website, of course. So, despite the stereotypes about LGBT older adults being wealthy and kind of living a good life, the reality for LGBT older adults is quite the opposite. This population faces 3 primary barriers to successful aging. And the report that we're releasing today addresses some of those with real-life quotes and anecdotes from LGBT older adults and the other communities in the room. First among them is social isolation. This is a population that's twice as likely to be single, and 4 times less likely to have children than their heterosexual and cisgender counterparts. And for those of you in the room who don't know what cisgender is, that's basically when your gender aligns with the gender assigned to you at birth. So if you're not transgender, you are cisgender. So they're much more likely to be single, much less likely to have kids, and also much more likely to be disconnected from families of origin. This is a population that also faces higher poverty rates than their heterosexual and cisgender counterparts. This is particularly pronounced among lesbian couples who have twice the poverty rate of their heterosexual counterparts. And you might think, well, why is this the case? I remember speaking to someone in one of our senior centers, and she said every time she came out on the job or was outed on the job, she basically had to move on. So she was either fired or was kind of forced out. So you can imagine someone in that sort of position isn't, meeting her career goals as she would like. In addition to that, this population faces a lack of access to culturally competent services and supports. So this is a population who is in greater need
critical services and supports provided by programs like the Older Americans Act, but they are much less likely to access those services because of fear of discrimination, because of actual discrimination when they go in to receive those services. So I'm going to end here with some quotes, just 3 quotes from the report we're releasing today that kind of fleshes out and gives you a feel for some of the issues and challenges people who are LGBT older adults are thinking about. The first one is from someone by the name of Randall in Oregon, and he says, "After being discriminated against all my life, I want some happy times. Is that too much to ask? I need LGBT welcoming services and should not have difficulty accessing them." The second quote is from Arthur in New York, and I just realized these are all men. So there's one woman's quote I'll read as well. "There's a stereotype that gay people are affluent. The truth is, most of us have led a hard life because of discrimination and lack of support. It's sad that many of us who fought so hard for liberation are now alone, forgotten, and barely surviving." Here's a quote from Madeline in Illinois, who says, "I don't wish to return to the proverbial closet to feel safe in an assisted living situation. I want to feel safe, housed in a place where bigotry is denied entrance." And lastly, a quote from Peter in Florida, who says, "My husband and I have no children, and we are estranged from our families because we are gay. I worry about entering an assisted living facility because I've heard that LGBT elders are being abused by homophobic staff. I worry that we are totally on our own." So I feel like these quotes give you a feel for some of the issues that LGBT adults are thinking about and some of the very real challenges they face. So with that, I'll turn it over. Please.
Good morning, everyone. I have to introduce myself in my traditional way. I'm Navajo from Arizona. I live in Albuquerque now. Those are my clans and those are my relatives. But I also consider all of you my relatives because we live in this nation together. So we all need to work together effectively and to work strongly to ensure that the people in our community are served. Thank you, Erin, for your presentation. I think our American Indian community is also affected with so many diversity issues as well. The LGBT community is very well known in our community as well. My name is Rondella Woodhouse, and I'm the Executive Director of the National Indian Council on Aging. We were founded by the Tribal Chairmen's Association in 1976, and our mission is to advocate for improved comprehensive health, social services, and economic well-being for American Indian elders. We also operate the Senior Community Service Employment Program as a set-aside national program for elders, providing training to elders 55 and older. We work in the most isolated rural areas of the country. The members of our American Indian communities who submitted comments during the public comment period strongly reflect a desire for federal outreach and accessible services to the deeply rural parts of the Indian country. Some states have not adequately facilitated outreach efforts to Indian nations, which prevents government-funded programs from reaching those with the greatest needs. Government-to-government respect and consideration for Indian nations is imperative and should be seen as an opportunity, not as a barrier for access to services. Many services and supports are unavailable and tragically underfunded across our demographic areas, such as coordinated services for elder abuse prevention and intervention, transportation, caregiver services and supports, and financial exploitation prevention. The comments we received from our communities overwhelmingly reflected the value of these programs where they do exist and the necessity of those programs where they do not exist. One commenter wrote, elder abuse seems to be occurring more frequently, and our tribal elders don't know how to respond with on what to do. They are too embarrassed to report it. We do not have a specific person employed by the tribe to deal with this problem. Another commenter shared that the life-saving importance of elder meal services funded by the Older Americans Act, and ours is specifically in the Title VI of the Older Americans Act, our meals make such a difference, she wrote. There are several elders who are homeless, diabetic, or poor health, and the balanced meals we serve keep them healthier for a longer period of time. Sometimes it is the only meal that they have all day. Additionally, over the last few decades, we have been seeing a growing trend of urban migration that must be acknowledged and addressed by federal, state, and local aging policies. The 2010 U.S. Census indicates that 78% of American Indians now reside off Indian lands, and services and supports that are available to them in urban areas must be culturally relevant and they must be accessible. The collected comments from our elders and allies urge policymakers to ensure that American Indian, Alaska Native, and Native Hawaiian elders are clearly identified in the aging policy. And it is critical that leadership make concerted efforts to provide aging and support services in Indian country. I would like to invite our board chairman, James De La Cruz, up to provide a few comments about aging across Indian country.
Yeah, good morning. It's good to be here. As Randall introduced herself, my name is James De La Cruz. I'm a citizen, enrolled member of the Quinault Indian Nation in the state of Washington. As I serve on the NICOA board, I'm the Portland area representative on that board, and I have been elected chairman. As I sit here and listen to this discussion and know sit here feeling, knowing our challenges today, that we're going to go out and talk to people about the services that we all very much need and deserve. Boy, who knows what's going to happen very soon. We really don't know, and that scares me. I was appointed by President Clinton to the 1995 White House Conference on Aging as a policy representative. And then we put out a good report on the statute and treaty obligations that this country has obligated to our Indian elders through their law. But as Randall reported, in 1976, Dr. Arthur Fleming, who was the first Administration on Aging Director, he was also the first Secretary of Health and Human Services, called for the National Indian Council on Aging. They printed a book that talked about services. If you look at that book today, maybe 2% of what we asked for and were obligated to has been achieved today. If things don't change faster, but we'll continue that. When we talked about those cards in 2005, we went to the White House Conference on Aging. They had comment cards, and on there, we went through all the town hall meetings and public hearings, and we talked about tribal and Indian programs. When we got to the White House Conference on Aging, there was no mention of Indian programs on the comment cards. We were excluded. We met. We had 21 delegates. We met, and we said, we're not going to take this. What we're going to do is we're going to go before your General Assembly tomorrow and stand with our mouths taped shut, because that's what you've done to us. overnight they printed those cards. And we were included in that. So our concerns to be held. That's the kind of things that we have to do here. That's the kind of things that we have to do today to continue now. The Hispanic people in Washington State, working with our tribal government, there's hearings all over the place. This room is filled, but all the time you can't.
Bien nuestros familiares o amigos. En la actualidad, quienes no tenemos a nuestros familiares cerca, debemos acudir al servicio que nos ofrece el gobierno para ser cuidados profesionales. Eso está muy bien. Sin embargo, las posibilidades de conectar con un cuidador que habla español es muy reducida. Necesitamos apoyo para entender lo que nos dicen nuestros médicos, las correspondencias que nos envían, los pagos que no tienen sus debemos hacer muchas veces los últimos consumos. Tienen sus especificaciones en inglés y nos hace muy difícil. Necesitamos personas que quieran pasar tiempo con nosotros. ANCOA nos garantiza clases de inglés, de computación, bailamos, trabajamos en el jardín, hay tardes de películas, celebramos nuestros cumpleaños, pero somos muchos, así que los voluntarios siempre son bienvenidos. Debe haber programas que nos permitan mantenernos activos luego del retiro. Hay quienes, como yo, continuamos teniendo energía y aún tenemos mucho que aportar a este país. No crean que queremos ser una carga. Trabajamos toda una vida para contribuir con el crecimiento económico del país que nos abrió las puertas. Solo pedimos que no nos lancen al olvido. Cada uno de ustedes andará por este camino. Tratemos de que sea lo más digno y respetuoso posible. Mil gracias. Que Dios les bendiga.
Thank you so much for being here. I think we are running a little bit short on time, but I am really honored to represent CRAF. My name is Kun Din. I'm the Executive Director of CRAF, the Southeast Asia Resource Action Center. We were formed in 1979 by a group of American humanitarians in response to the largest refugee crisis that our country had seen and the world had seen at the time, emerging out of Southeast Asia as a result of U.S. occupation throughout Vietnam, Cambodia, and Laos. Think about how much the world has changed since that last fall, and how timely it is for all of our communities to be standing here united in opposition of the Trump administration's executive orders attacking our immigrant communities, attacking refugee communities, attacking Muslim communities, because secondly, to mobilize our constituencies nationwide through a network of community partners and we found that over 60% of research respondents experienced post-traumatic stress disorder. And we're a community that faces extreme language barriers, where half of the Asian American and Pacific Islander community experiences some type of limited English proficiency. This rate is between 85% to 90% for our communities. And through this campaign, our elders also uplifted 3 major solutions: in-person assistance, in-language assistance, and comprehensive support by community-based organizations. The respondents shared, "My parents need help. Life is hard with no English. They don't offer Khmer anywhere else to help us." And others shared, "I need assistance with everything, from making appointments to filling out forms to reading my mail and taking me to appointments." And while demand for this type of support has increased through responses that we've seen, what we've also seen is a trend nationwide for a decrease and almost diminished support to community-based organizations who have served our older adults with culturally and linguistically powerful services. In 2000, we conducted a survey with 46 organizations in California who were serving elders in critical need. And we found that the majority of these organizations received no funding for the work that they did. Additionally, they had a staff of 10 or fewer full-time staff, part-time staff, and volunteers. And this reality has led to the reality of many of our organizations shutting down or continuing to remain open to serve an increasing growing demand. So as our nation shifts our attention to the priorities of a new administration, we're here to really uplift the voices of our elders and to find champions in Congress who are committed to closing these gaps for vulnerable communities, understanding that community-driven policy proposals are the solutions that we're going to need to expand protections for all in our country. Thank you.
Okay, thank you so much, Gwen. My name is Wes Lum, and I'm the president and CEO of NAPCA, which is the National Asian Pacific Center on Aging. Our mission is to preserve and promote the dignity, well-being, and quality of life of Asian American and Pacific Islanders as they age. We have served tens of thousands of AAPI older adults who represent the fastest growing segment of our aging population in this country. AAPI older adults are faced with many unique challenges, including cultural and language barriers and access to services and employment opportunities. We are glad to be here today with our coalition partners to discuss some of these challenges with leadership and allies in Washington, D.C. 80% of AAPI older adults are foreign-born, and 65% have become naturalized citizens of the United States. This continuously changing ethnic profile and immigration history of older Americans requires government organizations to pay particular attention to the unique needs of AAPI older adults. As you've already heard from Gwen and the comments received by CRAC, in-language access and community-based organizations play a significant role in ensuring that the aging members of our communities and their families can access services to meet their needs. What I want to talk about in my concluding remarks today is the need for government agencies to accurately identify who our communities are, so that we can also accurately identify their unique needs. The term AAPI includes over 25 ethnicities that speak over 50 different languages. Aggregating AAPI older adults into one ethnic category obscures meaningful differences between subpopulations, and analyzing the needs of AAPI older adults collectively masks their unique issues, leading to one-size-fits-all public policies that do not comprehensively meet the needs of diverse AAPI older adults. Robust variations between and among subpopulations must be understood and acknowledged. A commonly believed myth is that AAPIs are all self-sufficient and upwardly mobile. The prevalence of poverty is severe when disaggregating the data by ethnic groups. For example, in 2010, more than 1 in 5 Koreans, Tongans, and Hmong elders 65 and older were below the poverty level. Yet, older adult Malaysian households had a median income of over $90,000. Among the most impoverished AAPI older adult subpopulations are Hmong older adults, who have a median household income of approximately $18,000, and Bhutanese elders, of whom 63% are living in poverty. Without disaggregated data collection about our communities, we would be unaware of these differences, and the model minority myth will continue to mislead policymakers about the health and economic status of AAPI older adults. Some of the comments we received reflected the desire and the need for our communities to be counted. So many insights and people are missed with aggregated data, wrote one commenter. Disaggregated data will better identify needs and solutions. It is important to support community-led AAPI organizations to ensure that services are culturally and linguistically relevant and effective, said another commenter. Aggregated data collection has led to widespread generalizations, rendering the specific needs and characteristics of subgroups invisible. The variations among AAPI subpopulations in challenging issues such as family caregiving, Alzheimer's disease and related dementias, and elder justice must be identified in order to provide culturally appropriate services. So I'd like to turn your attention to your packet and specifically to the report titled The Emerging Needs of Asian American and Pacific Islander Older Adults, What We Know and What We've Learned. In 2016, in partnership with the White House Initiative on AAPIs, NAPCA convened listening sessions across the nation to understand the key issues facing AAPI older adults. We received incredibly rich, qualitative data from AAPI older adults themselves. I encourage you to read the report, to learn about our findings and recommendations, and to visit our website to learn how you can take action, to view a video montage of the listening session, and to sign up to partner with us to improve the quality of life of AAPIs as they age. I want to thank you again for joining us today at this briefing. We've touched on a lot of important topics, and NAPCA and members of the Diverse Elders Coalition invite you to explore the nearly 5,000 comments we received and the resulting policy recommendations that we've made in this new report, Aging with Health and Dignity. Copies are available here and will also be available online at the Diverse Elders Coalition website. We encourage you to share our findings with your colleagues, with other legislators and policymakers here on the Hill, with advocacy groups, and with other older adults and their allies who may be inspired to speak up about their own aging needs. The Diverse Elders Coalition will continue to advocate at the federal, state, and local levels for diverse communities, and we hope that you will join us in urging decision makers to enact policies that will support older adults of color, American Indian and Alaska Native older adults, and LGBT older adults. So now I'd like to open up the floor to questions for the remaining time that we have. No more time? Okay,